Hi, my name is Allison. I'm a nursing student, and today I'm going to be performing a head-to-toe assessment. Can I please ask for your name and date of birth?
My name is Jessica Cortez, and I was born on the 15th of November, 2002.
And do you have any allergies?
No.
Okay, so this assessment is going to involve me looking at and touching parts of your face, chest, back, stomach, arms, and legs. Is that okay?
Yes.
And please let me know if you feel any discomfort during this. So when I first look at my patient, I'm going to note that she is an age-appropriate female. She appears alert and oriented to the situation. There are no signs of any pain, discomfort, or distress. Also no signs of any diaphoresis, cyanosis, or pallor. Also no signs of any scarring, lesions, or erythema. So now I'm going to ask you a few questions about your health history. Have you noticed any changes in your general health or inability to perform your daily activities?
No.
Have you noticed any changes such as headaches, stuffiness, sore throat, or swollen lymph nodes?
No.
Have you noticed any difficulty breathing just during normal activities or during exercise?
No.
Have you noticed any new onset chest pain?
No.
If it's okay, can I ask when your last bowel movement was?
Like an hour ago?
Okay, perfect. And have you noticed any changes in your digestion?
No.
Have you noticed any joint stiffness or joint pain?
No.
Any numbness or tingling anywhere in your body?
No.
Do you take any medications?
No.
And do you or do anyone in your family have a history of any chronic illnesses?
No.
Okay, perfect. So now I'm going to begin my assessment. First, going to start by assessing the cranial nerve 7, the facial nerve. So I'm asking you to do a couple exercises with me. Can you raise your eyebrows for me? Perfect. Now wrinkle your forehead. Smile. Show your teeth a lot. Perfect. And puff out your cheeks. Good. Cranial nerve 7 is intact. So now I'm going to be assessing the lips. When I look at the lips, they are symmetrical, they are midline, they are also pink and dry, but they are not chapped. So I'm going to have you open your mouth for me, please. I'm going to be shining the light in. So when I look at the teeth, the dentition is good. There are no signs of any dental caries or missing teeth. Can you show me your gums for me, please? The gums are pink and moist, no signs of any swelling or bleeding. Okay, open up again. The oral and buccal mucosa are pink and moist. The tongue is midline. Can you say ah for me? The uvula rises and falls midline, and the tonsils are not visible. Okay, now one more thing with the light. I'm going to have you look at the bridge of my nose, and I'm going to shine a light in if that's okay. Okay, good. Perfect. Your pupils are equal, round, and reactive to light and accommodation. They show consensual movement. So now I'm going to do an exercise. I'm going to have you keep your head straight, and now I'm going to move my finger, and you're going to follow it with your eyes. Okay, perfect. So that was assessing for the 6 cardinal fields of gaze and for the cranial nerves 3, 4, and 6, respectively the oculomotor, trochlear, and abducens nerves. They are all intact and there were no signs of nystagmus. So now I'm going to be listening using my stethoscope on your chest to listen to your heart sounds. So just sit normally. So first I'm going to be listening at the aortic area, which is at the second intercostal on the right sternal border. Here both S1 and S2 are heard and S2 is louder. And now the pulmonic area in the second intercostal on the left sternal border. Here both S1 and S2 are heard and S1 is louder. Now Erb's point, which is at the third intercostal on the left sternal border. Here both S1 and S2 are heard and they are equal. Now at the fourth intercostal on the left sternal border. Here both S1 and S2 are heard and S1 is louder. Now lastly, the mitral area at the fifth intercostal in the left midclavicular line. Here both S1 and S2 are heard and S1 is louder. Rate and rhythm were normal and no extra heart sounds or murmurs were noted. While I was using my stethoscope, I was also noticing my patient's breathing pattern. Rate, rhythm, and effort are normal. So now I'm going to be using my stethoscope on your chest again. Each time I move it, I'm going to have you take a deep breath in and out through your mouth. Okay. Good. 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 Just going to move this a little bit. One more. Perfect. Vesicular breath sounds were heard and no adventitious breath sounds were noted. I'm gonna have you flip your leg around this way for me, please. We're gonna do a few more, but this time on the back. So deep breath for me. Perfect. Deep breath. Deep breath. Deep breath. Perfect, thank you. Again, vesicular breath sounds were heard and no adventitious breath sounds were noted, which could have indicated consolidation. So while we're in this position, I'm going to be assessing for the costovertebral angle. So I'm going to be just doing some light touching. Let me know if you feel any pain. Any pain?
No.
Any pain?
No.
Okay, patient reported no pain upon testing the costovertebral angle, which could have indicated something such as nephritis. So now I'm going to ask you to lie down for me, please, right here.
Okay.
And I'm going to be inspecting your abdomen, if that's okay. I'm just going to pull these down just a little bit. Okay. So when I first look at my patient's stomach, I'm going to note that there are no signs of any pulsations, no signs of hernias, no signs of any lesions or erythema. So now I'm going to be using my stethoscope to listen to the bowel sounds in all 4 quadrants, starting in the right lower quadrant. If I don't hear breath sounds after a few seconds, I will listen for 5 minutes in each quadrant. Okay, bowel sounds were heard every few seconds, so they are normal active. Now I'm going to be doing some palpation or touching, and I'm going to be asking you to let me know if you feel any pain during this. So first, light palpation. Any pain?
No.
Still no pain?
No.
Okay, now I'm going to be doing it a little deeper. Again, let me know if you feel any pain. Still no pain?
Nope.
Okay, perfect. Patient reported no tenderness, muscle tone was even throughout, no rigidity was noted, no signs of ascites, and no masses were noted. Okay, thank you so much. I'm gonna have you sit up for me, please. Sit right here again for me. And then... Okay, so now I'm going to be inspecting the upper extremities. So when I first look at the upper extremities, I'm gonna note that there are no signs of any erythema, no signs of lesions or rashes. I'm gonna look at the olecranon processes. No signs of any skin breakdown. I'm going to feel them with the dorsal aspect of my hand, and they're warm and dry to the touch. Now I'm going to do some palpation or touching again. Do you feel any pain?
No.
Nothing?
Nope.
Perfect. Patient reported no pain upon palpation, no edema was noted. So now I'm going to be looking at the radial pulses. Perfect, thank you. Radial pulses are 2+ strong and equal bilaterally. Now I'm going to do some capillary refill. Their fingernails are painted, but I can see through them. Capillary refill is under 2 seconds bilaterally. So now I'm going to be having you do a couple of exercises with me. So I'm going to have you move your arms outwards like this for shoulder abduction, and back down for shoulder adduction. Now go forward for shoulder flexion, and backwards for shoulder extension. Now you put your arms like this, and now go outwards for external rotation, go inwards for internal rotation. Put your arms out like this, and pull your arms in for elbow flexion, back down for elbow extension. Now you go like this for pronation, this for supination. Now I'm gonna have you go like this for wrist extension, down for wrist flexion, and now lastly do this for finger abduction and adduction. Perfect. The patient has full range of motion in the upper extremity, so now we're just gonna do that one more time, but with some resistance. So I'm gonna have you put your arms like this, shoulder or arms at your side. So I'll have you push your arms out against my hand. Okay, good. Now pull back in against my hand. Perfect. Now I'm gonna have you, I'm gonna hold right there, and now push out against my hand. Good. And now pull back in against my hand. Good. So for external and internal rotation. And now push out against my hand. Now pull back in. Perfect. So I'm gonna have you put your arms out like this, and I'm gonna have you pull your hand in for elbow flexion. And now push down for elbow extension. Good. pull in, and now push down. Good. And now I'm gonna have you do this, and then hold in there and try to resist my fingers closing them. Good. And now squeeze my hands to me. Okay, patient has 5 out of 5 strength in the upper extremities. So now I'm gonna be inspecting the lower extremities. So when I look at the lower extremities, I'm gonna note that there are no signs of erythema, no signs of any lesions or scarring or rashes. When I feel them with the dorsal aspect of my hand, they are warm and dry to the touch. Now I'm gonna do some palpation. Let me know if you feel any pain.
No pain.
No pain. Just gonna wash my hands really quickly. Any pain?
Nope.
All right. Patient reported no pain upon palpation. Now I'm going to be assessing the tibial plate for edema. No signs of edema. Now I'm going to be assessing the dorsalis pedis pulses. Dorsalis pedis pulses are 2+, strong and equal bilaterally. Now I'm going to be assessing, I can see slightly through the toenail polish for capillary refill. Capillary refill is under 2 seconds. So wash my hands. So again, I'm going to have you do a few exercises with me. Could you stand up for me, please? Okay. So I'm going to have you move one leg forward for hip flexion, and now go backwards for hip extension. Good. Other side. And now backwards. Good. Move one leg outwards for hip abduction, back in for adduction, inside, out, and in. I'm gonna have you turn your feet outwards for external rotation, and now go pigeon-toed for internal rotation. Good. Pull your foot back for knee flexion, put it back down for knee extension, pull it up for knee flexion, and down for knee extension. Now I'm gonna have you go on your tiptoes for plantar flexion. Good. And now go on your heels for dorsiflexion. Perfect. Thank you. So I'm gonna have you sit down again. We're gonna do a few more exercises. Patient has full range of motion in the lower extremities. We're gonna do a few exercises with some resistance. So I'm gonna have you pull your knee up against my hand. Okay, good. And now push down. It's for knee flexion and then extension. Pull your knee up. And now push it back down. Perfect. I'm gonna have you push your knee outwards against my hand for hip abduction. Now pull back in for hip adduction. Push your knee outwards for hip adduction, pull back in for hip adduction. So now I'm gonna do one more. You're gonna push your foot out against my hand for knee extension, and now pull it back in for knee flexion. Push your foot out for knee extension, and now pull it back in for knee flexion. Good. So now I'm gonna just lift up your foot, and I'm gonna have you push your toe down against my hand. So plantar flexion. Good. Now one more. Perfect. Thank you. So patient has 5 out of 5 strength in the lower extremities. So that'll conclude my assessment today. Your findings were normal for your age. Do you have any questions for me?
No.
Okay, perfect. Thank you.
Thank you.
That's it.